It is 8:20 in the evening in a typical Indian apartment. The television is on. Dinner plates are still on the table. A man in his late 40s reaches for the remote and his right hand does not move. He looks at his hand and tries again. Nothing happens. He opens his mouth to call his wife in the kitchen. The words come out heavy and distorted. One corner of his mouth is hanging down. His wife turns and sees his face. In that second, she feels pure fear. Something inside his brain has changed. While he is confused and scared, an artery in his brain is blocked. Millions of brain cells are being starved of oxygen every minute. If nothing is done within a few hours, he may not walk or speak again. He may not even recognize his own family. I am Doctor Heartwise. I work with patients whose lives can change forever in a single evening like this. Stroke is now one of the main causes of death and disability in India. Many people survive but with a body that no longer obeys them, and a life that no longer feels like their own. The painful truth is that many of those strokes could have been treated much better if someone had known what to do in the first hours. In this video, I will show you how stroke actually happens inside the brain, the early warning signs you must never ignore, and the modern treatments that can sometimes stop a stroke in the middle of the attack. Most important, I will show you what you and your family must do in those first hours to give the brain a real chance to recover. If you have parents or relatives over 40 who live in India, watch this video until the end, and plan to share it with them. This knowledge can protect years of memory and independence.
Stroke is often called a brain attack. Just as a heart attack damages heart muscle, a brain attack damages brain tissue. There are two main ways this happens. In about 85% of strokes, a blood clot travels through an artery and gets stuck like a cork in the neck or in the brain. This is called a ischemic stroke. Blood cannot pass the blockage, so the brain cells beyond it receive no oxygen. Without oxygen, they begin to die within minutes. In the other group, blood vessels inside the brain burst and leak. This is called hemorrhagic stroke. Blood collects inside the skull and presses on brain tissue. The pressure and the toxic effect of blood outside the vessel quickly damage the nearby cells. In both types, one rule is the same. Time is brain. The brain uses a large amount of the oxygen in your blood. When blood flow stops, nerve cells can only survive for a few minutes before they suffer permanent injury. Every minute more brain tissue is lost. On the outside, a stroke may look like a strange smile, a weak arm, or slurred speech. On the inside, it is a race between dying cells and returning blood flow. Modern medicine has tools to reopen blocked arteries and to remove large clots, but they only work well when used in time. If the window is missed, the damage becomes fixed and many abilities are lost forever.
If this sounds frightening, it is meant to be. Stroke does not only happen to very old people. It is appearing more often in middle-aged adults in India, especially those with high blood pressure, diabetes, smoking, and high stress. In the next part, I will show you a simple test to recognize stroke in seconds and explain the treatment window that can save the brain. Press like on this video so that more families see it before a crisis. Stay with me until the end. Most people lose precious time during a stroke because they do not know what they are seeing. They think the person is tired, stressed, or having low sugar. There is a simple set of letters that can help you remember the main signs of stroke and what to do. It is called BEFAST. It has already helped save many brains around the world. Now, it is your turn to learn it.
B fast is a quick way to scan the body and face for stroke signs. B stands for balance. A sudden loss of balance or coordination. The person may stagger as if they are drunk even though they have not taken alcohol. E stands for eyes. Sudden blurred or double vision or loss of vision in one eye or in part of the visual field. F stands for face. Ask the person to smile. If one side of the face does not move or the mouth is pulled to one side, this is a strong warning. A stands for arms. Ask the person to raise both arms in front of them. If one arm drifts down or cannot be lifted, that is another sign. S stands for speech. The person may have slurred speech, speak nonsense, or be unable to find simple words. Sometimes they do not understand what others are saying. T stands for time. If you see even one of these signs, treat it as an emergency. Check the time when the first symptom began and act immediately. In many countries, there are single emergency numbers. In India, these may vary by region, but the principle is the same. Call your local ambulance service or emergency number at once. Do not wait to see if the symptoms will pass. Do not put the person to bed to rest. Do not give home remedies. For ischemic stroke, there is a medicine that can dissolve the clot in the brain. This is called thrombolysis. International guidelines say it is most useful when given within about 4.5 hours from the start of symptoms. After that time, the risk of bleeding becomes too high compared with the benefit. When it is used in time for the right patient, this medicine can open the blocked artery and restore blood flow.
The window for this treatment is measured in hours, not in days. That is why knowing be fast and acting fast is so important. In the next part, I will tell you about another treatment that can sometimes remove large clots even when more time has passed, and show how both treatments depend on your speed and awareness. If you have learned something new so far, write "be fast" in the comments and tell us if anyone in your family has had a stroke. Share this video with one friend so that they also learn these signs. Now let me take you inside two real-type stories that we see more and more often. Both involve stroke and both involve modern treatment. The difference between them is not luck or money. The difference is how quickly someone recognized the signs and acted.
In the first story, a man in his late 50s is watching television with his wife after dinner. She hears a sound and looks over. He is sitting strangely, his mouth pulled to one side and his words are unclear. His right hand lies useless on his lap. Because she has heard about stroke, she does not wait. She calls the local emergency number at once and tells them she suspects stroke. The ambulance arrives quickly and takes him to a hospital with a stroke team. The doctors perform a brain scan which shows no bleeding. They confirm that the symptoms started less than 2 hours ago. He receives a clot-breaking medicine through a vein. The drug travels through his bloodstream, reaches the blocked artery and begins to dissolve the clot. Within a short time, movement returns gradually to his arm. His speech improves. He still needs monitoring and rehabilitation, but he returns home walking and talking with only mild weakness. Time and action protected much of his brain. In the second story, a woman in her early 70s lives alone. She goes to bed feeling normal at night. In the morning, she wakes with complete weakness on one side of her body and cannot speak clearly. She struggles to reach her phone and calls her son. He rushes to her home and calls an ambulance. At the hospital, the doctors see that no one knows exactly when the stroke began. It may have started many hours earlier while she was asleep. A standard clot-breaking medicine may not be safe now. In the past, this uncertainty would mean there was little that could be done. Today, in many centers, there is another option for some patients with large clots. Doctors can perform a procedure called mechanical thrombectomy. Through a small puncture in an artery in the leg, they guide a thin tube through the vessels up to the brain. Using special devices, they can capture the clot and remove it like pulling a plug from a pipe. When the clot comes out, blood rushes back into the starved brain tissue. This treatment can help some patients many hours after stroke onset if scans show that there is still brain tissue that can be saved. It is a modern achievement of medicine. However, it is still limited to certain hospitals, and it still depends on someone recognizing the problem early and bringing the patient quickly.
Both stories show one truth. The best machines and medicines in the world are useless if the person with stroke arrives too late. Your eyes, your memory of be fast, and your decision to call for help are the real keys. In the comments you can write whether you knew about clot-busting medicine and clot removal before this video. If you want more clear explanations like this for heart and brain topics, press like and subscribe so that you do not miss the next lessons. We have talked about fear and about advanced treatments. Now we must talk about your role and your daily life. You cannot control every event in your brain, but you can control how ready you are and how much risk you carry. This part is about what you and your family can start doing today.
First, memorize the be fast pattern. Balance eyes, face, arms, speech time. Talk about it with your family. Teach your parents, your partner, your children, and your colleagues. If everyone in your circle knows these signs, at least one person may recognize a stroke in time. Second, know which hospital near you has a stroke unit or a neurologist on call. In an emergency, it is better to go straight to a prepared center than to waste time moving from one small facility to another. Ask your local doctor in advance which emergency number and which hospital they recommend in your area. Third, take care of the risk factors that silently prepare the ground for stroke. Keep blood pressure within the target range through lifestyle and medicine if needed. Control blood sugar and cholesterol. Stop tobacco in all forms and limit heavy alcohol use. These changes do not only reduce the chance of stroke, they also protect your heart, kidneys, and eyes. Fourth, respect your sleep and stress balance. Chronic sleep loss and constant stress push your blood pressure higher and disturb the health of your arteries. Regular sleep timings, movement during the day, and simple daily relaxation habits help your nervous system recover. Fifth, if you have already had a minor stroke or a transient ischemic attack, follow your treatment plan very carefully. This may include blood thinning medicines, blood pressure medicines, sugar control, and lifestyle changes. A minor warning event is a strong message from your brain asking for protection.
If you have watched this far, you now know more about stroke than many people will learn in their entire life. You understand that stroke is a race against time, that minutes can mean millions of brain cells, and that modern treatments can help only when people act fast. Do not keep this knowledge only in your mind. Share it. Today, talk to one family member about Be Fast. Show them this video and ask them to watch it fully. Write in the comments where in India you are watching from and whether anyone in your family has had a stroke. Your story and your questions can guide future videos. Press like on this video so that more people who search for stroke in India find clear and trustworthy information. Share this video with at least one person over 40 in your life. Subscribe and turn on notifications so that you receive more lessons on stroke, heart attacks, stress, brain health, and heart health from Doctor Heartwise. Time is brain. The decisions you and your family make in the first hours decide how much of that brain can be saved. Start preparing now while there is still time.